Do you think that you are neurodivergent? Are you feeling stuck on what your next step should be? Or are you wondering if the hassle of getting a diagnosis is worth it? Stick around because in this video, I'm going to give you an overview of neurodivergence. So let's get started. To begin, let's get some definitions out of the way. Neurotypical means anybody whose brain is normal. Neurodivergence is an umbrella term for anybody whose brain works differently. Autism, ADHD, dyslexia, dyscalculia, even things like Tourette's and epilepsy can be put under this umbrella. Neurodiversity is the idea that there are many brain types. To keep this video simple, I'm going to focus on ADHD because that's what I know the most about, but I believe the advice works no matter what neurotype you are. And besides, there is so much overlap that it can get complicated quickly. So don't focus so much on the specific label because it's not really all that handy. Neurodivergents are known for our black and white thinking, so we often doubt ourselves and even our medical diagnoses. We'll have 9 out of the 10 traits, and because it's not a perfect score, we assume we can't possibly be neurodivergent. Here's the thing though, I have never met a neurodivergent person, diagnosed or not, that hasn't agonized over the possibility of them not being neurodivergent. Also, I've never met a neurotypical person that thinks about it at all. Neurotypicals don't suspect neurodivergence because they don't experience that sense of being different all their life. So if you believe that you're neurodivergent, you probably are. You don't need a diagnosis unless you want one. Reconciling your neurodivergence can be easy if you have the right support system and the right mindset. It all comes down to understanding yourself and expressing your needs. If you can learn to do that, there's no need to pathologize your neurodivergence. It's just a part of who you are, and you're awesome. But for a lot of us, reaching that level of self-acceptance requires a massive perspective shift. One that acknowledges and accepts neurodiversity in general, and then takes it a step further to acknowledge and accept the neurodivergence within themselves. There's absolutely nothing wrong with being different, but there is something wrong with hiding those differences from the people you love. If you can't find a way to be open and honest about how your brain works, or if you're struggling to manage those differences, getting a diagnosis can absolutely be the right choice. Before we get into the nitty-gritty of the diagnostic process, first, let's talk pros and cons. The first pro is that getting a diagnosis from a medical professional can be very life-affirming. Like I said earlier, neurodivergents have very black and white thinking, so having that expert opinion can make all the difference, because there's no more room for suspicion or speculation, and that can be a huge relief. Whether it's in a workspace, the classroom, or at home, getting your needs met is the first step in truly thriving. You can't succeed without help, and knowing what that help looks like and having the documentation to prove that you need it can make a huge difference. People can't support us until they know what we need, but for a lot of us, just asking for help feels risky. But here's the thing, until we learn to ask for the accommodations we deserve, we are going to struggle. Accommodations are not special treatment and they're not unreasonable. So whether you have an official diagnosis or not, stop treating your accommodations like a burden and start treating them like a non-negotiable. That's when you truly start to unlock your potential. You may need more than others, but you're also capable of more if you get your needs met. I get it though, sometimes when you're really struggling, just asking for the basics seems impossible. ADHD symptoms can make it very difficult to hold down a job, to maintain relationships, and just to live your life. This is especially true for women because we're expected to perform at a high level and hold down a household, which is very difficult when you have executive dysfunction. And that's where medication comes in, which is our next pro. Getting a diagnosis means that you can get treatment, and if doctors are good for anything, it's drug dealing. Just kidding, kinda. In all seriousness though, it's a good thing that you need a prescription from your doctor to get stimulants. They are not for everybody, and there can be major complications that need to be addressed by a doctor, especially if you need to try multiple types of medication and doses to get it right. Medication can give you a sense of control that you've never felt before. It can silence the many conversations that are going on in your brain at once. But it's not a cure-all. And it's important to remember that no one medication fits all. It's extremely personalized. What works amazingly for one person could be a horrible experience for another. Be patient. It's going to take some time, even if it is the right medication. And write everything down. The date, the medication, the dose, and side effects. I know this is really difficult for ADHDers to remember to do, but if you can get into this habit, it could save your life. One more thing. A lot of doctors will tell you that if you have a history of drug abuse, then you shouldn't take stimulants. This is not true. Now, obviously, this has nuance. There are going to be people that really should stay away, but if you feel confident that you're not going to go into a cycle of abuse, then you need to push this issue if you really want to try those medications. Let's get into our cons. The first con is doctors. This isn't specific to neurodivergence. Doctors can be very problematic for all sorts of people, but it definitely has an effect because the average med student only gets 1 hour of neurodivergent training in all of med school. And unfortunately, medical biases are the standard, especially if you're a woman. Unless you deal with a doctor that specializes in neurodivergence, you're probably going to come across at least one that is completely dismissive of your experiences. They can be ignorant, arrogant, or just plain clueless when it comes to ADHD and autism. Advocating for yourself is an absolute must. Dealing with doctors can be a nightmare, so I'm going to give you one piece of advice. If you ask for a test, a medication, or a referral and they refuse, insist that they write your request and their refusal in your file. A paper trail helps you remember, especially if you switch doctors, and it holds them accountable. No doctor wants a paper trail that leads straight to their negligence, and that's just enough incentive to convince them to take a closer look, to just make sure that they haven't missed anything. Remember, they're just people with more knowledge about medicine, sure, but probably not more knowledge about neurodivergence, and certainly not more knowledge about you. You are the expert of you. And that goes for everyone, not just doctors. Which goes into our next con, ableism. People are going to try to tell you who you are and what your limits are in every situation of life. Whether it's the workplace, school, the hospital, or home. They are not the experts of you. You do not need to take on the identity that they have given you. They will try to use your neurodivergence to prove that you are incompetent. Don't let them. You are absolutely brilliant, but you haven't learned how to reflect that light yet. And you never will if you continually hang out with people that actively dull your shine. Because when your needs are met and you know your strengths and values, you can use them to thrive in ways that you couldn't possibly believe right now, whether you decide to get an official diagnosis or not. So let's move on to the diagnostic process. Most ADHD and autism tests are a combination of a written test, usually multiple choice, and a behavioral analysis done while you're taking the test. There are a number of factors that they consider, but at best, it's still just an educated guess. The problem with the written tests is that they're most likely written by a neurotypical. I say this because they often have questions like, do you struggle with social interactions? Or do you take things literally? I don't know how to answer either of those questions. Do I struggle with social cues? Well, do you mean now? Well, no. Did I when I was a child? Absolutely. So much so that I studied psychology and the science of people to get better at social cues. It makes me wonder how often these tests are inaccurate. Not to mention that the behavioral analysis is also skewed. For ADHD, they're looking for your inability to focus in a 3-hour or longer test, which makes sense, except taking a unique test, one that you've never seen before, while being observed by a stranger, and trying to get these answers right is going to create the perfect storm of executive functioning. This doesn't mean that we're not struggling when we're not in that perfect situation. But especially for diagnosis, you want to have actual stories. You don't want to go in there saying, I have memory problems and I can't concentrate and I have mood swings. You want to go in there and say, I forgot my keys at home 4 days in a row and I had to break into my house every single time to get in. Or I drift off into my own thought in mid-conversation with my partner or my kids. If you're really intimidated by the doctor, you're more likely to freeze and your mind will just go blank. So that's why having your notes with you can really help you advocate for yourself. Remember, doctors work for you. I'm not saying you should skip the diagnosis. I'm saying that the time between now and the potential diagnosis, no matter how long that ends up being, can be better spent gaining self-knowledge. There are so many tips and tricks to help your brain function in this world. And the more you learn about yourself and neurodivergence, the more you'll be able to advocate for yourself in all situations. So how do you learn about yourself? Well, first off, you ask your partner, your family, your friends, even your coworkers if you dare. Keep a journal and ask yourself questions like, what do I value and what are my strengths? I think the problem I have with the diagnostic system is that it focuses on the ways that you mess up. And I don't think that's as helpful as focusing on the things that you're good at and building a life around the things that light you up. ADHD and autism and all other neurodivergence can be extremely difficult to deal with, but those challenges make us stronger. They make us smarter. And we need to start celebrating that within ourselves and our community. So learn all that you can. Knowledge is power. And if neurodivergents are capable of anything, it is knowledge-based. We love to hyperfocus and dive deep, and that needs to be celebrated too. Thanks for watching. I'm Kristen. This is Creatively Divergent. Please subscribe. I make these videos every week, so don't miss out. And I'll see you in the next one. Bye. Like a mind map, right? You have all of these ideas, and that's how we have to live our lives. We have to kind of go all out and see all the different possibilities and stop trying to limit ourselves by neurotypical standards, because I'm telling you guys, we can fly.